it's starting. So today we're going to do a head to toe assessment and we're going to do a room scan. And that's the wall and that's the ceiling. And we'll start with the general appearance. So Mr. Mike Montagna, can you tell me your date of birth, just the month and the day?
June 25th,
Can you tell me the date today?
April 23rd, 2021.
And do you know where you are?
My house,
And do you know why you are here?
an assessment.
Okay, I'm gonna put this away. And so do you know the President of America right now?
Biden,
Okay, so he's alert, oriented, to time, place, person, and situation. He's responsive. His speech is fluent in his language. It's effortless. It's smooth. His color, no cyanosis, no pallor, no jaundice, nor erythema. And his visual acuity, we use the Snellen chart by letting him stand 20 feet away, using his prescription glasses, and it was 20/20 vision. And I did calculate his BMI by using his weight, which is 150 pounds, divided by 5 feet 10 inches or 70 inches, and times 703. The conversion factor resulted to 21.5, which is normal, within normal limits. I did check his vital signs. The respirations are 16, pulse rate is 84, and the temperature is 97.6, and the blood pressure is 124/82. I will start with checking his head and face, and so checking the size and shape of his head, checking the inspecting for any infestations of his scalp, palpating for any abnormal protrusions, depressions, any lumps and bumps, any pain. And then I'm checking the temporomandibular joint. Can you open your mouth? I'm checking if there's any crepitations, limited range of motions, and pain. And then I will check the symmetry of his face, cranial nerve number 7. Can you raise your eyebrows? Put it down, close your eyes. And can you show your teeth as you smile? Put it back. So there's symmetry of his facial nerves, the eyebrows, eyelids, the nasolabial folds, and the sides of his mouth. Cranial nerve number 7 intact, and checking, palpating the frontal sinuses and the maxillary sinuses. And I will check the, where is my, here. This is my pen light, and I'm checking now the 6 cardinal points of this. Can you just follow this? And now I'm checking your pupil response. Oh, can you cover your eyes, or your one eye, and then and just look up. Okay, and just checking now the size. Okay, and then cover one eye again, and just look straight. Look up. Okay, so the pupils are responsive to light. So pupils are equal to light. Pupils are equal, responsive to light and accommodation. Responsive to light and accommodations. They are equal. Pupils are equal, responsive to light and accommodation. And then the pupil size is 6 millimeters. The conjunctiva, I inspected the conjunctiva and the sclera. And then I will check the external ears, and then yeah, it's still on. And then I will check the external ears, and the auditory meatus. And then I will palpate for any pain, check for any skin lesions. No, and then I will check the whispered voice test for cranial nerve number 8.
Daisy, flower.
Okay, and then that was checking cranial nerve number 8. I'll now check your nose for any inflammation, lesions, any deviations, and the symmetry of your nose. And then I will palpate it if there's any tenderness, abnormal protrusions, and I will check the patency of your nostrils. Can you do this? And then I will check the mouth and throat. So inspect. Well, I have to get my thumb blade. So inspect that. So I'm checking the teeth for if any abnormal protrusions, many missing teeth, and then the uvula, if it's in midline position, the tonsils, if there's any exudates, and then the buccal mucosa, and then the floor of the mouth, and then the soft palate and the hard palate, the tongue for any for the tongue, the dorsal surface and the ventral surface, and then the gums. And that's it. Can you say ah? There was the soft uvula and the soft palate and the uvula rose up. And that was checking cranial nerve number 9 and 10. And then can you stick your tongue out? Put it back. And that was checking cranial nerve number 12. There's no deviation. It's in midline position. And now I will assess your neck. Can you please take out your shirt? So as I'm checking for any enlargement of glands on his parotid glands. Oh, it's still on. Yeah, it's still on. The parotid glands, the salivary glands, the thyroid glands, and then I'm assessing the range of motion. Can you extend your head up back? Put it down to the chin towards your neck, and then side to side, ear to shoulders. It's okay. And then now I am palpating the lymph nodes, checking now starting with the preauricular lymph nodes, the postauricular, the jugulodigastric, submaxillary, submental, superficial anterior cervical, deep cervical, and supraclavicular, and occipital nodes under the base of the skull, and then the posterior cervical in between the cervical spine. And then I will palpate each carotid pulses one at a time. And then using the bell of my stethoscope, I will auscultate the carotid pulses for any signs of bruise. Take a deep breath and exhale and hold it. Same goes with the other side. And that's it. And shrug your shoulders against my resistance. And that's it. That's for the neck. And I will start with your proceed with your upper extremities. So I'm checking the skin characteristics, the presence of edema, and any lesions, palpating skin temperature, and then any presence of can I check your nails? The nail beds, if it's firm, presence of clubbing by checking the profile sign if it's 160 degrees or less, and checking the accessory capillary refill. It should be less than 3 seconds on all his fingers. And then radial pulses, and then checking out the range of motion of your hands. So do this and flex, bend it up, and then spread your fingers, put it back, and then put this back, and then pronate, supinate, and then pronate, and then just your fingers curl, and then put it back, and then put it back again up, and then curl your fingers and pull me against resistance. That's it. And then bend your shoulders, extend all the way, and then put it back, and then move against resistance and pull. Okay. And then can you raise your your hands all the way to your head, put it back, and in front all the way to the back. Any problem with that?
No.
Okay, so that was checking your upper extremities. I'm going to proceed with your heart. I will first check the apical pulse rate and rhythm here. And then start with the aortic valves. The angle of Louis here. Second intercostal is aortic, pulmonic, tricuspid, mitral valve, using the bell of my stethoscope. Aortic, pulmonic, tricuspid, mitral valve. I heard S1, S2 or lub-dub sounds, and then I did not hear any abnormal findings such as extra murmurs or clicks, or extra heart sounds or clicks or murmurs. And I will now proceed with checking your thorax. So I'll start with the anterior thorax. I'm assessing the skin characteristics of his anterior thorax, use of accessory muscles, any retractions or bulging appearances, respiratory rate, breathing pattern, the position while he is taking a breath, and then no cyanosis, no pallor. And then I will check also the posterior thorax, the skin color, and then the elliptical downward shape or cone shape, and I will auscultate your lungs, trachea or larynx, and proceed with the anterior lungs, side to side. So there are 5 lobes here. 3, 4, 5. I heard bronchial sounds or high-pitched sounds on the larynx and trachea, and then I heard bronchovesicular sounds or medium-pitched sounds on the upper of the sternum, and vesicular sounds are low in pitch. And then I will proceed with the posterior thorax here. So there are 9 lobes here that I have to assess and auscultate. Take a deep breath, deeper than usual, and same goes with every time I put the stethoscope. I'm gonna go around his scapula. 8, 9, 8, 9. Okay. So can you move forward? Can you face in front? And can you just sit down, because we didn't do your left thorax. So can you raise your left arm? So left upper thorax, right lower thorax, put it down. Left upper thorax, right upper thorax, right middle thorax, right lower thorax. So I heard bronchovesicular sounds in the major bronchi, and then I heard vesicular sounds on bronchovesicular sounds are medium in pitch, and then vesicular sounds are low in pitch. Low pitch sounds on the all peripheral fields of his lungs, and so I will proceed with checking his neck vessels, but I have to let my patient lie down in a supine position with head of bed elevated. I'm gonna adjust my computer. Okay, with head of bed elevated to 45 degrees angle. So can you, yeah. So I'm checking, can you please rotate your head on the right side? Checking for any presence of JVD on the other side. Okay. And so it's flat, and I'm checking the abdomen, checking for any the contour and symmetry of his abdomen, and then I'm also checking the skin characteristics, any discoloration, cyanosis or pallor, checking the umbilicus if it's in the midline position. I'm checking if my computer is still on, yeah, and then I'm checking the umbilicus if it's in the midline position. I am checking any pulsations or movement, like aortic pulsations, respiratory movements, and then the waves of peristalsis. I am checking now. I will auscultate using the bell of my stethoscope the aortic, 2 inches, and then the renal arteries. And then I will auscultate using the bowel sounds using the diaphragm of my stethoscope. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, and I will do a light palpation, 1 to 3 centimeters, to check the general musculature of I'll check if my computer's still on. Yeah, general musculature, any enlarged organs, any pain, and then I will check all over areas of his abdomen and do the same thing as with using a deep palpation to check any enlarged organs, any tenderness. And now I will proceed with the lower extremities. I'm gonna adjust my computer, and I am checking the palpating the skin temperature I'm assessing the skin color and lesions, the venous patterns, the hair distribution, and the presence of pretibial edema, then the dorsalis pedis, and then the capillary refill. And then can you point your toes together, and then feet together, and then put them back again, and then can you pull against resistance, push against resistance, and doing a Babinski reflex, this one, doing an inverted J, oops, yeah, it's a little ticklish. And then can you sit down, and we'll assess your knees, check, okay, it's still on. And then can you raise your knees one at a time? No, just extend, sorry, extend. Yep, and put it back. And then push it against resistance, pull, and then I'll do a deep tendon reflex. Oops. Very good. And then that's the quadriceps leaf reflex. I'm doing the biceps reflex. Can you just do that, and then you just relax? That's the Babinski reflex. And then we'll proceed with the knees. Is it still on? Yeah. And then do this. Extend. No, you have to stand up. And do that. And extend it all the way to the back. And then with the other knees too. Leg, extend, and to the back. And we're doing the neurologic function. I will make you walk, not just normal walking, and then come back, and then do the tandem walking, heel to toe. Okay, very good. Come back. Okay, there's a good balance. Okay, and then close your eyes for 20 seconds. We'll check your Romberg test. We'll do Romberg test for 20 seconds. Check your balance. 20 seconds. And negative Romberg test. That was our negative Romberg test. And we'll make you sit down. I have to make you sit down, and we'll check your pain sensation by using sharp and dull. Let's see if it's on. Okay. Sharp and dull. Okay, this is dull and sharp. Close your eyes. Sharp. Can you tell me if it's sharp or dull?
Sharp, dull, sharp, dull, sharp, sharp, dull, dull, sharp.
Okay, and then using cotton, I will whisk a cotton on your face, and let me know. Say now as soon as you feel it.
No.
And you're using a rapid alternating finger movement. Do this as fast as you can. Okay. And then touch your heel against your shin. And then another one. Okay. So I have to make you stand up. And then can you show them your back? Okay, we will assess the straightness of your spine here. Here's Venus process, straightness of his spine. As he is standing up, I'm checking the symmetry of his shoulders, scapula, hips, and gluteal folds as he is standing up. And there should be a convex curvature of his thoracic spine and concave curvature of his lumbar spine. And can you touch your toes? Yeah, so there is symmetry. Can you touch your toes? Yeah, okay, it's okay. So I was checking the symmetry of his while he was touching his toes. I was checking the symmetry of his shoulders, scapula, gluteal folds, and hips. There was a symmetry, and then there was a C curvature. And as I stabilize, can you move face forward, face in front? And as I stabilize your hips, you can put your hands on the waist, As established, rotate your upper extremities right and left, and then bend it side to side. Okay. All right. That's all. So that ends our head to toe assessment.